My channel. In this video I will discuss what is pericardial effusion. So there is excessive fluid around the heart. In case of pericardial effusion, that is surrounded by pericardium, that is the outermost layer of the heart. This excessive fluid can compress your right ventricle because it is less stronger than your left ventricle, and therefore it causes decreased diastolic filling of the right heart, and it can lead to the features of right heart failure. The causes of pericardial effusion can be tuberculosis, systemic lupus erythematosus, rheumatoid arthritis, Dressler syndrome. This is a complication of myocardial infarction that is seen 2 to 4 weeks after the myocardial infarction, and in this case there is acute pericarditis that can lead to the development of this pericardial effusion. You can also see this in hypothyroidism in case of malignancies, trauma that can lead to blood in the pericardial cavity, and bacterial and viral infections can also lead to the development of pericardial effusion. What are the signs and symptoms of pericardial effusion? Patient presents to you with shortness of breath. There is low BP because there is decreased diastolic filling of the right heart, leading to decreased flow towards the left heart, and therefore there is low BP. Your pulses become weak, and there is pulsus paradoxus. It means that when you take breath, then there is increase in the downfall of the blood pressure more than 10 millimeters of Hg. Therefore this is pulsus paradoxus during inspiration. There is rise in the JVP, and the area of the cardiac dullness on percussion is increased. Furthermore, there may be muffled heart sounds on auscultation, and due to right heart failure there is enlarged tender liver, ascites, and peripheral edema, especially pedal edema and sacral edema. So these are the signs and symptoms: shortness of breath, weak pulses, pulsus paradoxus, that is fall in the BP during inspiration, raised JVP, cardiac dullness area is increased on percussion, and the heart sounds on auscultation are muffled, and there is enlarged liver, tender and enlarged liver, ascites, and peripheral edema. These are the features of right heart failure also. Investigations: on ECG there are decreased amplitude of the QRS complexes, or there may be electrical alternance, that is some QRS complexes are large and some are small, so this is called electrical alternance. And X-ray chest shows globular heart due to presence of fluid around the heart. The echo helps us quantify the amount of fluid that is surrounding the heart, and it confirms our diagnosis. Pericardiocentesis is done for diagnosing the underlying cause or for detecting the underlying abnormality that is causing pericardial effusion. TFTs should be done because hypothyroidism is also a cause of this pericardial effusion, and if you suspect autoimmune disorders, then ANA, rheumatoid arthritis, and anti-CCP etc. can be done accordingly. Treatment: if the effusion is small, observe and treat the underlying cause. For example, in case of TB, you should start on anti-tuberculous drugs, while if the effusion is large enough, then it can lead to cardiac tamponade, and therefore you should do pericardiocentesis, that is removal of the fluid from the pericardium, and it is done through from below the Zephyr process. The needle is inserted towards the left shoulder, and in this way you can pierce the pericardium and can drain the pericardial effusion.